Hello, my name is Shandon Williams. I'm with Isthmus Wellness, and today we have our PEMF lead therapist from our Sauk location, Hannah. So thank you for joining me.
My pleasure.
Hannah brings decades of experience in the wellness and health industry, and we're so lucky to have her in charge of the PEMF up in Sauk. And so today we're just going to have a little chat and talk a little bit about her experience so far, what you've been seeing with clients, as well as just your testimony and everything. So I think, to start, I know you've worked as a massage therapist, so you have like a unique ability to understand what your hands are feeling. And I'd love to know like how the PEMF has changed your recommendations or has affected the people, that get PEMF massage. Like, what are you noticing on the soft tissue front in that kind of realm that not all of us can necessarily see? What do you feel like are the changes that you notice with people that do PEMF and then receive massage from you?
Yes. So one example I can think of is I have a client who does a lot of long road trips, and she has some hip and lower back pain. And we have our sort of standard protocol. We do a 90-minute massage, certain topicals that help with muscle soreness and even musculoskeletal pain,
Yep.
So we had done one of those 90-minute sessions with her usual add-ons after a long road trip. And she came out after the massage, and I looked at her walking up to the front desk, and I said, "You look just as stiff as you did when you walked in. Let's try 30 minutes on the PEMF." And she said, "Okay." And I can tell you that when she walked out after that little 30-minute PEMF session, that she was walking more freely, more easily, and she reported less pain.
Yeah.
So that's one example that comes to mind. Another one is a client I have who plays a lot of pickleball and had that tennis elbow situation going on.
Yeah.
So he had been having it for a couple of months, and we would work on it every time he came in for
massage. Okay.
Yes. So we would do trigger point work on it, and he was appreciative and said it would feel better for a couple days. And then we did one session of PEMF on the pain points, that one elbow that was bothering him, and he said it has never bothered him again.
Wow.
Yes.
This is what I heard from Nicole too, this tennis elbow thing.
Yes.
They should probably rebrand it to pickleball elbow.
Yes.
Pickleball is the new tennis. Okay. Well, that's so cool. So was that a 30-minute or 60-minute that he did?
I can't remember. I want to say a 60.
Excellent. So he didn't even have to do the full course. He was one and done.
Not for the elbow.
Yeah. Awesome. I know that you're pretty active yourself. You're teaching classes. You're, in addition to working for us, Hannah is trying to improve the health and wellness of a lot of people in the Sauk Prairie area through different means. But I know that you've had a personal experience with some of the PEMF and your shoulder. And so I'd love to hear a little bit more about what kind of transpired with that for you.
Of course.
Yeah.
So I sustained a shoulder injury on my left shoulder like a year ago. I was teaching a transition from a side plank to a regular plank or push-up position, and I tweaked one of my rotator muscles. And then I went home and picked up my heavy toddler, and he likes to ride on that left side. And then I was realizing that my shoulder was not very happy, and nothing that I did that would normally have helped it was helping. And I'm at the age where my hormones are shifting and soft tissue injuries are more likely and take longer to heal. So eventually I got around to trying the PEMF on it. And by that point, it had been going on for 8 months. So it was August by the time I tried the PEMF on it. And I did the jump start. So 3 hour-long sessions within about 7 days. And it was feeling awesome. It felt so good. And the really interesting thing for me, because I'm a bit of an anatomy geek, was sitting on the PMF. You know how the current goes to the area that you tend to, like, that it needs the most.
Yeah.
To put it
that's real.
briefly. So I felt it go. It was really interesting to watch it move through the shoulder muscles in the areas that it started in. And then it was like those muscles cleared and it moved into other muscles. And I can feel it pulsing and the muscles twitching in a new spot. So that was cool. And then we went to a water park and I got that left arm stuck behind me going down a water slide. And it was like, oh no, I just undid all the PMF work.
Yeah.
Because that hurt. And then I woke up the next morning and it was fine, which it shocked me, frankly. And it was awesome because it showed me that the PMF sessions had healed it enough to where it could recover from that kind of experience, where I just spent 8 months struggling to get it even basically functional. And then the final 2 pieces were finding some scar tissue in the acromioclavicular joint with the aid of some gua sha from one of our staff members, some gua sha work to break up the scar tissue, and then a little more PMF to help with the inflammation and the response to the gua sha work.
Awesome.
So the shoulder's feeling really good now, and now the physical therapy exercises that just did not seem to be working earlier we're gaining ground and strength and coordination that just wasn't happening because of scar tissue and inflammation.
So you got a new shoulder.
I feel like it. And it brings me so much hope to realize that it is possible to take that kind of complex injury and untangle it.
Yeah. Yeah. So I know that you have some experience kind of also in some of the Western care models as well. And I think, like with the PEMF, sometimes people learn about it. It's like, is this just like this like holistic therapy that, some hippies made up, or what exactly is it? How long has it been around? That type of thing. Can you kind of speak to the validity of it?
Yeah. So there's a huge body of research out there around PMF, and it's continually growing. Caveat, of course, is that you need to look for well-designed studies, ideally like a placebo-controlled, double-blind kind of study. But they're researching PMF for, mood situations like anxiety and depression. They're researching it for multiple sclerosis, for erectile dysfunction, for sleep, obviously for pre-surgery, kind of reducing pain and improving function while you wait for surgery, and then post-surgery, again, reducing pain and swelling and improving function and facilitating the healing process.
Yeah.
And I know but there are multiple professional sports teams that use PMF for their athletes, both for the athletic recovery and if the athlete needs surgery to facilitate a speedy return to the field.
And do you feel like that's something that coaches or trainers or doctors around here are starting to kind of recognize? I know obviously in the NFL, they've got the big bucks for all of these things, but locally, is the PEMF something that's on the mouths of these Western providers, or is it still a little bit more unknown?
There's a few, I think, who are referring it for post-surgical treatment, for example. My family travels regularly to the Twin Cities area, and there's quite a bit of PMF therapy available up there as well, and even a company that's developing a wearable device.
Oh, a wearable PMF.
Yeah. Around here, I feel like the saturation of understanding in the conventional medical profession could be deeper, especially in that orthopedic surgery setting and the sports medicine in general.
Sure.
And that's one of the reasons we got the chair at the Sauk Prairie location of Isthmus Wellness, because if you have limited mobility, it can be difficult to climb up onto a massage table for a treatment session, but you can sit down in a chair usually relatively easily.
Yes.
So if your mobility is limited in general, it makes the PMF therapy more available. if your mobility is temporarily limited, it makes it more available. And we really love that.
Yeah, we like that. Good. So as far as what you've been seeing in your Sauk location, we've heard a little bit from our Madison location, but what, because sometimes I feel like even patient populations can change slightly. Like, what kind of conditions are you finding that you're tending to recommend the PEMF for, and that are responding well?
One big one is, when you get that pesky knot behind your shoulder or in your neck.
Sure.
It works really well on that.
Okay.
Clients that don't feel all that comfortable with massage can come in and have a PMF session to treat something that you might normally use massage for. So sometimes people will say, well, I'll send my parent in for PMF because they just don't like the idea of massage.
Yeah.
Obviously, it has started to shine as a solution for tennis elbow. And I've had a couple clients recently with torn muscles that then result in compensatory patterns further down a limb.
Sure.
And the PMF can be helpful in treating like some of the patterns. It's not going to fix a torn muscle, right? But it can help with some of the patterns that develop where the body's trying to make the movement happen, but doesn't quite have that muscle in place to do it.
Okay. And for all of us non-medical people, is it
a compensatory pattern?
Can you kind of break that down a little bit?
Good idea. So let's say I have a pulled muscle in my hip.
Okay.
Or no, a more personal example. I have an ACL reconstruction. So I have a new ACL in one knee. And there's a gait change that can happen in the recovery process. And if you don't catch it, that just sort of sets in and then your gait is permanently different. You can do exercises to regain that regular gait and that function and make sure you're not a little bit sideways in your posture or in your pelvis as a result of the difference in that joint. But if you don't, then you would have what we would call a compensatory pattern because the information you're getting from that joint is not quite the same as the information you're getting from the original joint. That's one example of a compensatory pattern. Another would be, I have a client that I have a couple clients with torn pectoral muscles. And so when you don't have that chest muscle there's certain motions that the pectoral muscles do that rotate the arm in and out. And without that ability, it'll resource other muscles to do the job instead. Sometimes called splinting.
Okay.
But that can affect the elbow. So what we've seen at the Sauk Prairie Clinic with these clients is that they have a change in the way things are firing in the elbow because the stress of this one piece of muscle not fully functioning is going all the way around here and then down to here and all the way into the forearm and sometimes down to the hand and wrist. Does that help?
That helps.
Okay.
Thank you. I feel like, of everything going on with the PEMF, it sounds like a lot of injury basically is what you're seeing. And I guess my question is there a waiting period? Do I need to clear it with my doctor or do I need to wait a couple weeks after a surgery? When do you recommend to come in for it? Basically, if there's pull something or whatever.
Outside of our normal medical intake contraindications, like having metal devices in your body or being pregnant, those sorts of things, I don't think you need to wait. My personal opinion, always a good idea to check with your doctor first. I would use it in the acute stage immediately post-injury. We've seen a lot of success in that setting, and I would definitely use it post-surgery. I may have a bias toward the injury stories because it's really exciting to me as an injury-prone athletic person to see those kind of results. But I have also seen it, it has an immune-boosting function. So I have put my husband on it when he looks like he's coming down with something. And the first time I did it, the symptoms were gone the next day and he carried on with his life. a merry man. And the second time I did it, it cleared his sinus congestion in 30 minutes.
Okay.
And
so it's good for husbands too.
It's good for husbands too. And then, so I think your original question had a little bit of something to do about sessions. And we, outside of the tennis elbow, which can sometimes be in place for a while and then be cleared, apparently, in one session of PEMF. Outside of that, we usually see, like if an injury is really fresh, 1-2 sessions of PEMF, maybe 3 can clear it completely. If it's been a condition that's been going on for a while, you may need more sessions to clear it. And, there was an example I was thinking, okay, we have a woman who's been coming in regularly for something that has been going on for a long time. And then she came in one day for one of her scheduled sessions, and she had just had a fall where the handle of a door she was opening came off in her hand, and she fell backward. She fell backward onto some concrete. So she had a very acute bit of bruising and soreness. And in that more acute instance, she found that PEMF helped a great deal. There was a very noticeable improvement. We love that example at Sauk Prairie because it was such a clear instance of she's already coming in and seeing improvement for something that's been in place for a while.
Yeah.
And now she had a chance to see how quickly the PEMF could shift something that was quite recent.
I like that.
Yeah.
Interesting. So I suppose I'm just curious, like, how has your practice changed as a massage therapist with the addition of the PEMF? Like, I know I was once a massage therapist years ago, but, it was always like, okay, I got to do this. I got to fix this with my hands, maybe some cupping, maybe some gua sha. But like, how do you feel your practice is starting to change with incorporating the PEMF device?
It's like having an assistant, right? The client can sit on the PEMF beforehand let's go back to that trigger point example, like the knot behind the shoulder or in the upper back or in the neck. We can use heat to help soften the tissues and relax the client before we work on that area. But I have found the PEMF to be helpful in getting the tension in that one focused area to dissipate a bit before I even touch hands on them. And then yes, it is awesome. And then layering in the heat as well, it just melts. Yes.
And do you find that people are getting the PEMF and your massage, do their results tend to last longer? Or, it just sounds like you're kind of peeling away more layers when you come at it with both things. I'm just curious if you're seeing that clinically. I know what's true for one person isn't necessarily true for everyone, but for what you're seeing clinically, what's the timeline or the length of, because I remember when I was a massage therapist, it'd be like, oh, I felt so good. And then I came back like 2 days later and I was like, okay, well, either A, I need to add something, B, you need to eat something specific or drink something specific, but to get your body and mineral content to actually hold the treatment for longer. But I'm curious, like, if you're seeing patterns emerge yet.
Pretty much that exact pattern. The terrain that the client creates by how they treat themselves, how they feed themselves, how they hydrate themselves, how they do recovery makes a big difference in how soon they come back. The tricky thing about that is that sometimes we don't have all the pieces of the puzzle that we need to take care of ourselves. And I think that some of the things we offer at Isthmus that are a great example is like the GI map, right? Because I can be doing all the things that I think I need and something is out of whack in my gut and I'm missing that puzzle piece until I get eyes on that, and maybe I do come back 2 days later because that knot behind my shoulder came back. At that point, I'm going to look at that client, and if they're ready for that piece of news, I'll say, I think we're missing a piece here because you're back already. And on other people, I'm seeing these results last longer.
Yeah. So it's time to dig deeper sometimes.
Yes.
Yeah. Yeah.
And that can be a long path. Sometimes it takes years to figure out what it is that your system needs.
Okay, so I want to just back up a little bit because you talked about how you used it to clear sinuses. Now, I'll be honest, I have not made any recommendations or referrals, and maybe I should because I feel like so many people were sick over this holiday season. But it sounds like you've had success for sinus issues. So can you speak more about like if we're just looking for an immune boost, or should we come if we notice something, or what is your recommendation on that?
My recommendation on that is sort of based on personal practice and what I've tried on my family so far, which is if we feel something coming on, if I see something coming on, we go do a 30-minute session.
Okay.
And at this point, we've tried it enough in the last couple of months and had good enough success that I'm processing how to start telling clients that, because generally clients will say, I'm getting sick, I'm sick, I'm going to reschedule so that I don't get other people sick.
Sure.
So navigating that situation where they could potentially just head off the sickness completely, maybe throw a mask on, come in and do a 30-minute PEMF session is where I'm at.
Yeah.
Getting ready to start talking to my clients and saying, next time you feel like you're coming down with something, why don't you come in and do a 30-minute PEMF session? We can throw a mask on, you can do some hand sanitizer. Next time you're coming down with something, or you think you're about to, you feel like you're starting to get the sniffles, let's try a 30-minute PEMF session.
Yeah, I like that. The more tools, the better.
Yes. And it can save you so much trouble if you are able to say, oh, I feel like I'm coming down with something. I know just what to do. I know just what to do to make that not happen and save my weekend or my work day or whatever it is.
Yeah. Yeah. I have not been sick in a year and a half, and I plan to keep that going. So thank you for sharing that. That's all I have for you today. So thank you, Hannah, for coming on and talking with us and just sharing the ins and outs of the PEMF and your experience. I hope you guys find value from this. And it sounds like you need to do the PEMF next time you feel a sniffle coming on.
Let's try it.
All right. Thank you.
Thank you.